So my name is Darcy, and I've been coming to see Dr. Lapenski for about 4 years now, since 2021, which is when I moved states. And I have actually been getting upper cervical care for about 17 years, since I was around 38 years old. I'm 55 now, so a long time. And I was having, at that time, I was having severe nerve pain in my neck and my left shoulder, to the point where my shoulder became frozen and I couldn't use my left arm for over a year very much. So I was in bad shape. And I had seen a specialist who told me that I had a very unusual congenital birth defect in my spine, where my entire mid-spine, called the thoracic spine, had only formed partially. So it was a birth defect. And excuse me. And then I had also severe scoliosis in my neck. The C7-T1 juncture, which is at the base of the spine of the neck, was at a 45-degree curve, which is pretty radical. And so the specialist who saw me was very surprised at my spine, and he said, well, you know, all I can say is you have a very unusual spine, and you know, you should be in more pain and discomfort than you're in. So at the time I researched and found out about upper cervical chiropractic, and the reason I specifically looked into upper cervical chiropractic was because I was advised not to have anyone adjust my mid-spine. And I was having still a lot of neck pain, a lot of shoulder pain. So I found out about upper cervical, which would just adjust the upper spine. And I found some practitioners in California, which is where I was living at the time. It was a different style. It wasn't NUCA, the National Upper Cervical Association style of upper cervical. So there's a number of different upper cervical styles. That one was called IUCA, and I did get significant relief from that upper cervical. It took about 3-4 months, but then my shoulder unlocked, and it took probably another several months before the pain really started to decrease, and I could really feel a significant difference in my mobility. And so over the years, I stuck with upper cervical. I moved from California to Colorado, and at that time I was seeing another IUCA upper cervical practitioner in Colorado, who subsequently moved to Hawaii, and so I was forced to just start fishing around for another practitioner. And so I did see several other types of upper cervical practitioners, but none of them worked very well. And until I found another NUCA, I found actually a NUCA practitioner. And I had actually accidentally encountered a NUCA practitioner several years before I found this person in Colorado when I was visiting a friend. I was actually in Oregon, and my neck went out and I needed to find a practitioner, and I found this practitioner, and he did something called NUCA, which I hadn't heard of, but it was an upper cervical style. So I went ahead and went to see him, and his adjustment was the best adjustment I'd ever had, and it lasted much longer than the other adjustments, and I had much more significant relief. And unfortunately, I couldn't keep going to that practitioner because I didn't live in Oregon. Went back to Colorado, but remembered that NUCA practitioner over the years. I found another NUCA practitioner finally in Denver, who I started to see and saw him for a number of years, and got pretty good relief from his, but I had to keep going back every couple of weeks. I think he was, there are 4 levels to NUCA practitioners, and I think he might have been just at a 1 or 2 level. So then I moved again, and I moved to northern Idaho, And when I was in northern Idaho, I tried every single upper cervical practitioner who was living in that area, and none of them worked for me. The correction that they gave was not adequate. And so I didn't know what to do, and I can't remember how I found out about Dr. Lapenski, but I was probably researching wider and wider areas to see if I could travel to see someone, and found out about Dr. Lapenski and called him and talked to him. And even though it was a distance, you know, I was in northern Idaho, it's about 5 hours from Seattle, by car, about an hour by plane, from where Dr. Lapenski works. I decided to try it, and it was the best decision I ever made. So I immediately, when I was adjusted the first time by Dr. Lapenski, felt that it was very similar to the adjustment I had years ago by the other NUCA practitioner in Oregon. Both adjustments are radically different from any other adjustment I've had, including other NUCA adjustments. So I was really happy to find Dr. Lapenski, and immediately noticed that my symptoms were much more controlled by his adjustments, and they were lasting longer and longer. So I've been seeing him for 4 or 5 years now, and I just held for 6 months, which is the longest I've ever been able to hold. I have I'm unusual in that I have an extreme spine, extremely unusual spine. Probably, I've been told by Dr. Lapenski I'm in the top 1% of the patients that he treats in terms of, you know, the radical condition that my spine is in. But he's able to get me to hold still for long periods of time, fairly symptom-free. I mean, I do have some arthritis in my neck, so, you know, cold, damp weather, certain weird sleeping in a wrong position, I can still have some neck pain from time to time. But I would say the vast majority of the time I'm completely pain-free. And I do believe without this care, I would be on disability now, and that I would be unable to work. Because when my spine goes out, it's a long, slow, miserable decline in my health, including pretty significant pain in the neck, immobility, especially on the left side of my left shoulder. I'll have sciatic pain, I'll have knee pain, I'll have digestive complaints. Sometimes I stop sleeping, or I'll sleep very, very poorly. So, you know, I'll have heart palpitations. That's a common symptom too. So the upper cervical adjustment, yes, it really helps with back pain, spinal pain, but in my experience, it affects every single organ system in the body. It affects my mood. So when my spine is really misaligned, I'll have extreme anxiety and extreme depression. And when the alignment is correct, again, I'll go back to being normal. Normal levels of anxiety. I mean, everyone has some anxiety in life, right? Life isn't perfect. So it's quite, in my experience, you know, I've been to probably 6, 7, 8 different types of upper cervical practitioners. And even I've seen, I think, 3 or 4 NUCA practitioners. And even within the field of NUCA, there can be quite a difference in the skill of the practitioners. So depending on your level of disability, it might be worthwhile for you to travel and go ahead and see someone who's a level 3 or 4 practitioner. Even if I would say it's worthwhile to travel to another state. It's hard to, I'm an acupuncturist, so I have an active practice, I have patients, and I sometimes try and refer specific patients for upper cervical care. it's hard for them to understand how upper cervical is different from regular chiropractic. And even so, then there's that tier. There's the fact that upper cervical chiropractic in general is different from regular chiropractic. And then there's the next tier up, which is the different types of upper cervical chiropractic are also very different. And then there's what I would call the third tier up, which is the level of skill, even within NUCCA, which I believe to be head and shoulders the best, no pun intended, the best upper cervical chiropractic adjustment that I've experienced by a wide margin. Even within that field, there's a quite wide range in practitioner ability. Unfortunately, because it would be easier for everyone to have access to top-notch care if it were an easier skill to learn. Yeah, I think because I've experienced such a wide variety, I really know the difference, and so I try to explain that to people so they can understand that there's a big difference. I also explain that the brainstem, and it sits right at the base of the skull, right on top of the spine, and so that brainstem regulates your heart rate, your circulation, your blood pressure, your breathing, like your oxygen levels, all of that. And also touches on what we call the fight or flight response. So the fight or flight response, which is our stress adaptive response, is also located in that region, the limbic system, the amygdala, and then the hypothalamus, in those areas of the brain. And so I do believe that there's a profound effect on mental health that also comes when you have misalignment in that area, and it affects the body and the brain's survival mechanisms. It triggers them. So that, for example, someone who might have an extreme accident, like a ski accident, car accident, or even just minor sometimes childbirth, it doesn't even have to be that much of an impact, but these misalignments can set people up for a lifetime of debility and poor mental health. And so I personally think the NUCCA adjustment is profound for human health. And I wish we had a whole lot more of it.
For sure.
Yeah, around the world, not only in this country.